Good morning or good afternoon, guys. Give me a minute to set up for the show, please, and I'll be right with you. Okay. For discussion A today, we are discussing research shows clear gender differences after spousal loss. Widowed men tend to experience longer lasting declines in physical and mental health, including higher mortality and dementia risk, while many widowed women show greater short-term distress but more resilience over time. These patterns are linked to social support, caregiving roles, health behaviors, and pre-loss psychological resources. Men face longer men face larger, broader health declines. Large longitudinal analysis reports that widowed men have higher risks of mortality, dementia, functional decline, and persistent depression compared with non-widowed men and with widowed women. Women often show greater resilience over time. Several cohort studies find that although women experience acute drops in well-being after losing a spouse, many recover and in some measures even improve in later years. Psychological resilience before loss matters, especially for men. Pre-widowhood resilience buffers increases in depressive symptoms. Men with higher resilience show much smaller or no increases in depression after spousal loss. Why gender differences appear. Mechanisms: social networks and support. Women typically maintain broader social ties and are more likely to seek emotional support. Men often rely primarily on a spouse for social and practical support, so loss can produce a sharper social isolation effect. Caregiving and role change. Men who were less involved in household tasks or health management while married may lose practical supports. Medication management, appointments, worsening physical health, Health behaviors and help seeking. Widowed men are less likely to seek mental health care or adopt compensatory health behaviors, increasing downstream risks. Practical implications and recommendations. Screen and monitor men proactively for depression, cognitive decline, and functional problems in the months and years after spousal loss. Boost social supports and practical help. Meal delivery, medication management, community programs targeted to newly widowed men. Build resilience before and after loss through grief counseling, skills training, problem solving, social engagement, and connecting people to peer groups. Evidence shows resilience reduces long term depressive symptoms. Limitations and cautions. Heterogeneity. Not all men fare poorly, and not all women recover quickly. Individual trajectories vary by culture, societal economic status, health at baseline, and the circumstances of the death. Study contexts differ. Findings come from multiple countries and cohorts, affect sizes, and which outcomes are most affected can vary by study, design, and measures used. Bottom line, widowhood affects men and women differently. Men are at higher risk for sustained physical and cognitive decline, while many women show greater long term psychological recovery. Targeted screening, social support, interventions, and resilience building are evidence supported strategies to reduce these gendered health gaps. Here, here is a clear, grounded explanation of the text based entirely on the surrounding page content you're viewing. What the article is saying in plain language. The article reports on a large Japanese study showing that men and women experience spousal loss very differently, especially when it comes to long term health and emotional outcomes. Men's health declines more rapidly or more sharply after losing a spouse. The study found that men tend to experience greater drops in both physical and mental health after their partner dies. This includes higher risk of depression and dementia, lower levels of happiness over time, a decline in social support, even though men become more socially active after the loss. The article suggests that social activity alone doesn't meet men's emotional needs during grief. 2. Women often show improved well being over time. In contrast, widowed women in the study reported increased happiness and life satisfaction in the years following their spouse's death. This doesn't mean the loss isn't painful. Rather, their long-term trajectory tends to be more positive. These patterns appear across cultures. The article connects the Japanese findings to similar studies in the US and Denmark, which also show that widowed men face more severe health risk than widowed women. Why women may be more resilient. The article highlights several explanations. Women often maintain stronger social networks due to lifelong caregiving roles. And relationship building responsibilities. These networks can be activated during grief, providing emotional buffering and practical support. Men, by contrast, may have invested more heavily in work and less in social connection, leaving them more isolated after loss. 5. Implications for support and mental health care. The article argues that grief support should be gendered responsive. Men may need intentional help building or rebuilding social support networks to reduce isolation and health risks. Understanding these gendered patterns can help mental health professionals tailor interventions more effectively. Broader societal meaning. The article frames these findings within cultural expectations. Men are often socialized to be stoic and avoid seeking emotional support, which worsens outcomes after loss. Women's increased happiness post loss challenges stereotypes about widowhood and grief, showing that resilience can take unexpected forms. In short, the text explains that men tend to suffer more serious health consequences after losing a spouse. while women often show long-term emotional resilience. These differences are tied to social networks, cultural expectations, and lifelong gender roles. And they point to the need for more targeted support, especially for grieving men. Okay, guys, that is A for you. I will be back on shortly with B. Give me a bit for that, please. And I'll have that for you shortly. For now, Gator Wellness, take care, folks.